Alcohol and Drug Counselor Exam ADC Practice Test and Study Guide. 25 must memorize questions. Question 1. Which of the following is a symptom of alcohol withdrawal syndrome? Bradycardia, hypotension, tremors and sweating, excessive sleepiness. Withdrawal from CNS depressants like alcohol typically causes autonomic hyperactivity, tremors, tachycardia, diaphoresis. Question 2. In the stages of change model, trans-theoretical model, a client who is considering quitting but has not yet taken action is in pre-contemplation, contemplation, preparation, action. Contemplation is the stage where the individual is aware of the problem and thinking about change. Question 3. What is the primary purpose of motivational interviewing? To confront the client about their lies, to resolve ambivalence and increase internal motivation for change, to provide a list of 12-step meetings, to prescribe medication for addiction. Me is a client-centered, directive method for enhancing intrinsic motivation. Question 4. Which drug is an opioid antagonist used to reverse an overdose? Methadone, naloxone, buprenorphine, diazepam. Naloxone, Narcan, rapidly reverses respiratory depression caused by opioid overdose. Question 5. The term dual diagnosis refers to a client having two different substance use disorders, a substance use disorder and a co-occurring mental health disorder, a physical illness and a substance use disorder, a diagnosis from two different doctors. Co-occurring disorders, mental health and SUD, are common in addiction treatment. Question 6. In counseling, transference occurs when the counselor shares personal stories with the client. The client redirects feelings for a significant person onto the counselor. The client stops coming to sessions. The counselor refers the client to another agency. Transference is a psychological phenomenon where clients project past feelings onto the therapist. Question 7. Which of the following is a classic sign of Wernicke-Korsakoff syndrome? Jaundice, confusion, ataxia, and memory loss. High blood pressure, increased appetite. Caused by thiamine, B1, deficiency often due to chronic alcohol use. Question 8. The CAGE questionnaire is used for assessing depression, screening for alcohol use disorders, diagnosing schizophrenia, measuring intelligence. CAGE stands for cut down, annoyed, guilty, eye-opener. Question 9. What is the primary goal of the harm reduction model? Enforcing total abstinence, reducing the negative consequences of drug use without necessarily requiring abstinence, mandating jail time for users, closing all liquor stores. Harm reduction focuses on safety, example needle exchanges, regardless of usage status. Question 10. Which of the following is considered a central nervous system stimulant? Heroin, cocaine, alcohol, Xanax. Cocaine and amphetamines increase CNS activity. Question 11. When a counselor encounters an ethical dilemma regarding client confidentiality, what is the first step? Call the police. Consult the ethical code and a supervisor. Tell the client's family. Ignore the problem. Consultation is a key part of ethical decision-making. Question 12. What does the S in the SOAP note format stand for? Symptom, subjective, summary, situation. Subjective info is what the client reports, feelings, history. Question 13. Which of the following is a self-help group for families of alcoholics? AA, Al-Anon, Smart Recovery. Al-Anon is specifically for friends and family members of people with alcoholism. Question 14. In group therapy, the forming stage is characterized by Conflict among members. Members getting to know each other and establishing rules. The group finishing its work. High productivity and deep trust. Tuckman's stages. Forming is the initial orientation phase. Question 15. Which medication is used as an aversion therapy for alcoholism by causing sickness if alcohol is consumed? Naltrexone, disulfiram, acamprosate, Valium. Disulfiram, antabuse, blocks the breakdown of acetaldehyde, causing severe reactions to alcohol. Question 16. The enabler in a family system typically confronts the addict, protects the addict from the consequences of their behavior, has the addiction themselves, is the child of the addict. Enabling prevents the addict from experiencing the rock bottom necessary for change. Question 17. What is tolerance in the context of drug use? Being nice to people who use drugs. Needing more of the substance to achieve the same effect. The legal limit for driving. The duration of the drug's effect. Tolerance is the physiological adaptation to a substance. Question 18. A counselor must break confidentiality if a client admits to using drugs, expresses a clear threat to harm themselves or unidentifiable others, misses 3 appointments, is unhappy with the service. The duty to warn Tarasov and safety are legal/ethical exceptions to confidentiality. Question 19. Which of the following is a symptom of opioid withdrawal? Constipation, meiosis, pinpoint pupils, piloerection, goosebumps, and diarrhea. Euphoria. Opioid withdrawal is often described as a severe flu, cramps, diarrhea, runny nose, goosebumps. Question 20. What is the primary focus of relapse prevention therapy? Curing the addiction forever, identifying triggers and developing coping strategies, finding a job, discussing childhood trauma. Relapse prevention focuses on maintaining change by managing high-risk situations.